Hi, I'm Dr. Papri Sakar. I'm a board-certified dermatologist in Boston, and I'm here because Eczema Honey asked me to answer your questions about eczema today. Before we start, I wanted to remind you that this video is for informational purposes only. It's not intended for self-diagnosis or treatment. If you have any questions about your medical condition, please contact your board-certified dermatologist or your licensed healthcare professional. Is eczema better controlled with steroids or with natural creams? So both creams, natural creams and steroids, I think have a place in the treatment of eczema. What I find is that if eczema is really inflamed, a steroid really helps to decrease that, because steroids are things that our body naturally makes and that are anti-inflammatories. So they definitely have a place in the arsenal of eczema treatment. The problem with steroids is that if you use them too often, or if you use them for a long period of time, they can cause changes in the skin that we don't want you to have. So it can thin your skin, it can cause dilated blood vessels in that area, etc., etc. So because of that, our goal as dermatologists is to really decrease how often you're using steroids, if at all. And that's where the moisturizer comes in. So if you prefer natural products, using a natural moisturizer as often as possible and keeping your skin as hydrated as possible will really help to prevent you from getting a flare, so that you may not need steroids. A lot of times if you have a light flare, then you can get away with just increasing your moisturizer or hydration. But if you have a serious flare, if you have an infection, in addition to having eczema, like infected eczema, then you will often need steroids or some other treatment, like a topical antibiotic. And then in terms of natural creams in particular, if you're looking for something, I like things with oils in them in general. Just make sure that it's not an oil that you're allergic to. For example, like if you're using a product with a nut oil, make sure that you're not allergic to the nut, right? Because you can react to it. Like I said, oatmeal is great, honey is great, and generally shea butter is great, coconut oil is great. All those things are really great in terms of the natural products for eczema in particular. Okay, other than sunscreen, gentle cleanser, the use of hyaluronic acid and vitamin C, any other daily treatments to keep your skin healthy and moisturized while living in a desert climate? I love this regimen that this person mentioned. It's great. These are all the things that I want you to be using. The only other thing I would add if you're in a desert climate is, because desert climates are so arid and dry, I would actually add a humidifier. So for me, what I usually recommend for my patients is to put a humidifier in the bedroom and then also one in the living room or in the other room that's the most frequently used. So for some people it'll be the living room or the family room. For other people it'll be the kitchen. In my house it's definitely the kitchen, but also one in your bedroom, because you tend to spend a lot of time there, for a long period of time. In addition, some people get a little desk humidifier for their office that they bring in, because we spend an awful lot of time at work. And then the last thing is that if you can't afford a humidifier, or you can't, you don't have access to one for whatever reason, what you can do is fill your bathtub with water and just leave it full. And then the water will hopefully evaporate. It tends to evaporate and it tends to go into your atmosphere. It tends not to work as well as a humidifier, which forcefully pumps out humidity into the air, obviously. And if you don't have a tub, you can use big pots. Those are just some of the options. The other thing to know about humidifiers in general, which I would be remiss if I didn't mention, because patients with eczema tend to get more infections on their skin than other people, is that you must clean your humidifier. It's really important. Humidifiers tend to be, pump out water, so they're very moist environments, and bacteria and fungi and mold all love those environments. So you just have to be careful if you have one, and make sure that you clean it according to the manufacturer's directions. And the last thing about humidifiers is that if you have a pet or a small child who may not know that they shouldn't go near the humidifier, then get a cold air humidifier versus a warm air one. The hot humidifiers tend to pump out quite hot steam, and because of that, your pet or your child can get a burn. So, common sense caution for things like that. But otherwise, they're great. They work really well. How long does the treatment of eczema take, and is there a drug prescription to help fight it? There's lots of different medications that we can use for eczema, not just steroid creams. We have lots of new medications, biologics, which are biological, medicines that work via a biological mechanism that we use for eczema. There are so many things that we have in our arsenal now, non-steroidal creams, etc., etc. The thing is that it really depends on the patient in terms of how long it will take to fight it. We even use light therapy or UV therapy for some of my patients, and that usually takes, anywhere from 6 to 8 weeks to really see results. Whereas a steroid cream, depending on how severe it is, if it's milder, it may only take a few days. So how long it takes depends on you, and what you should use is really dependent on what you and your doctor decide together. So this I would definitely have you go see a dermatologist for. Board certified dermatologists are all over the country, and they all treat eczema. Okay, so steroids. What are the concerns with the use of topical steroids? The problem with steroids is that if you use them long term, they can cause side effects in your skin. So we really don't like people to use them long term. They can cause thinning of the skin, and they can also cause dilated blood vessels. The big thing with steroids is that you are better off if you use them for less days. So some people think that what they should do is, kind of stretch out how long they're using them and only use a very small amount at a time. I prefer that my patients use it twice a day, but for a shorter number of days, and then put it away as if they don't have it. Because I'd rather them use it for less number of days in a month, if that makes sense. How can we make sure that we're correctly managing our steroid cream use? That is huge, and that's something that we really keep track of. The way that we keep track of it as doctors is that we keep track of how often you need a refill or how often you're refilling your medicines. If you keep running out, it's probably because we either didn't give you enough for the area that you're treating, or more likely that you're using too much or too often. So in general, I tell all of my patients as a blanket to not use it more than 14 days in a month. And that doesn't have to be consecutive days. So you can use it, 4 days in a row, and then put it away for 2 weeks, and then use it another 2 days. It doesn't have to be, 14 days in a row that you use it and then you put it away. In fact, it's better to use it. We find that people use less steroids if you use it multiple times a day for a shorter number of days and then put it away, and then it's only after a flare starts again that you use it again. Ideally, my goal, of course, would be to get my patients off all steroids if I can. Every dermatologist differs on that though, so you should discuss that with your derm in particular. Why does my skin always clear up when I'm on steroids and antibiotics? Is there anything that I can take regularly that has the same effect on my skin without the negative side effects of these strong medications? And the person who asked the question also mentions that the steroid that she's referring to is something called prednisone. Prednisone is an oral steroid. So I would say that, prednisone is a really strong steroid, and usually dermatologists don't give that for eczema unless there's something pretty serious going on, or unless you're infected as well. And there's a kind of eczema that we sometimes will give steroids for. The one that we most commonly give it for is contact dermatitis. So we see that a lot with poison ivy, which is a type of contact dermatitis where you're allergic to the poison ivy and you get big blisters all over your skin, and they can easily get infected. If your dermatologist is giving you prednisone and antibiotics often for your eczema, you have a pretty severe case. In general, I would say. For atopic dermatitis, I almost never need to use that, but for prednisone and the antibiotic combination, the important thing to know is that if you have a skin infection, your eczema will not go away. It won't go away until you treat the infection. There's really nothing that you can do unless that infection is under control. So a couple of things that we would do in that case is figure out what it is that you're infected with, right? Because lots of different things can infect people with eczema. You can get an infection with the bacteria. Sometimes if it's an infection with the bacteria, people harbor it in their nose or in their bum. And so what we do is we swab their nose, and we actually treat their nose too. If it's positive, we'll have the patient take an antibiotic cream and put it in their nose, actually with a Q-tip or a cotton swab. The other thing is that viruses can infect eczematous skin. So if you have eczema, you're much more likely, if you have a cold sore or something like that, to touch that and then touch your eczema and then have it really disseminate or kind of go wild all over your eczematous skin. We see that quite often, and it's really unusual. It's really unfortunate because it's painful and itchy and all the things. So for that, you usually take an antiviral. If it's happening really often, we can put you on a daily medication for that. You just take it with plenty of water, and you try to make sure that you're not exposed to cold sores or, the herpes virus, which is what causes cold sores on your eczematous skin. So there's other things that you can do. And then one of the other things that we sometimes do, which sounds crazy but does work, is that we have you actually take a bath, like fill a whole bathtub with a cap, not a cup, like a cap full of bleach in it. And I don't recommend anyone do this without seeing your doctor first, but we have you put the cap full of bleach in the water, and then you sit in it, and what it does is it decreases bacterial carriage so that you're less likely to get an infection from the bacteria that's already on your skin. If you like this video, please like or subscribe to it so that we know that we should make more. If you really enjoy it, please share it with a family member or a friend. And if you have any questions, leave them in the comments below and we'll answer them for you.